Ceann Comhairle, I'd like to thank you for the opportunity to update the House today in relation to the national response to the ongoing COVID-19 pandemic. You'll all be aware of the significant decisions taken by government over the past few weeks in relation to the new measures put in place to combat COVID-19. I'd like to share with the House why these decisions were made. The epidemiological situation has deteriorated substantially in recent weeks. The level of infection has increased rapidly, and our 14-day incident rate is now 1,410 cases per 100,000 population. In addition, the OR number was estimated last week to be between 2.4 and 3 for the country. The incidence rates are very high across all age groups, especially young adults, and across every part of the country. Incidence in those 65 and older remains high and a cause for concern. The numbers in hospital and in critical care are increasing and putting enormous strain on our hospital system. And our thoughts and prayers are very much with those in critical care right now and with their families and with their friends. We know that most people who get the virus will have mild symptoms that resolve themselves, but we also know that we can expect to see a proportion of people infected with the virus who require hospitalisation. We know that a smaller percentage of them will require intensive care, and we know there is a percentage as well, tragically, Ceann Comhairle, who will die. I want to extend my heartfelt sympathies to the families and the friends of those who have lost their lives so far to this awful disease. The prevalence of new COVID variants is also a very considerable concern. The highly transmissible variant first identified in the United Kingdom highlights the importance of strict adherence to public health guidance. It is now more important than ever for everyone to stay at home, to avoid social contacts, and to double down on our efforts to suppress this virus. In tandem with our efforts to limit person-to-person transmission, we must continue to identify the disease in our community. Testing and contact tracing continues to be essential in how we fight this virus. While what's going on right now, Ceann Comhairle, is really difficult for people, there is hope. In recent weeks, 2 vaccines have received regulatory approval from the European Medicines Agency, and a third will be decided on before the end of the month. Ireland's COVID vaccination programme is now well and truly underway. As deputies will be aware, the programme has been further accelerated to deliver the first dose of vaccinations to all nursing home residents and staff by Sunday week, that's Sunday the 24th, and to all residents over 65 years of age in residential disability and residential mental health settings, and to approximately 70,000 frontline healthcare workers, both in hospitals and in the community. Colleagues in the House and people all over Ireland are very understandably asking which priority groups are going to be vaccinated by when. People want to know when they're going to be vaccinated, when their loved ones are going to be vaccinated, when those most vulnerable are going to be vaccinated. To date, Ceann Comhairle, only 2 of several possible vaccines have been authorised, and neither Ireland nor any other EU member state has accurate delivery schedules for any vaccines except Pfizer and Moderna, the 2 that are authorised. Because of this, it's not possible for Ireland or other member states to accurately predict vaccination deliveries and therefore vaccination levels really past the end of about February. Nonetheless, I'd like to provide the House with at least some provisional numbers. We're planning on receiving enough vaccines to be able to vaccinate 700,000 people by the end of March. Critically, this would vaccinate the top 3 groups on the prioritisation list. That's those in long-term residential care, staff and residents, frontline healthcare workers, and our population of people over 70 years of age. We're further planning to be able to vaccinate more than 1.5 million people in Q2 and more than that again in Q3. At these levels, people most at risk of COVID-19 would be fully vaccinated by the summer. I want to stress, Ceann Comhairle, however, I'm providing this information to colleagues in an effort to give some sense of where we're moving and at what speed, but these numbers are highly provisional. They include estimates for delivery schedules for vaccines that are still to be approved, and I hope colleagues will treat the numbers and the forecasts in that context. Work is ongoing to ensure people have easy access to vaccination details, including the numbers who have been vaccinated. I know there's a lot of interest in this. Updated figures, I'm delighted to be able to share, will be available on the COVID Data Hub from this weekend, and regular updates will of course follow. Work is also underway to add vaccine numbers administered to the COVID Tracker app as soon as possible. I'd like to finish by making 2 points. The first is I want to thank once more everyone working across Ireland's healthcare system for continuing to step up at our country's time of crisis, from hospitals to community health teams to those working in GP practices, in pharmacies, voluntary organisations, nursing homes, and everybody in between. And secondly, I'd like to reiterate just how serious the situation is right now. The UK variant, which is far more contagious than anything we have dealt with so far, now accounts for in excess of half of all new cases. The way we support our healthcare workers, the way we keep each other safe right now, is to follow the public health guidelines and to stay at home. Thank you.